Hi everyone, welcome back to Forward Therapy. My name is Kelly Troutman. I am a certified hand therapist, and today's video is the 7th and final part of our wrist tendonitis series, How to Treat Wrist Tendonitis. So if you have stuck with me for this long, you are the true freaking MVP. I thank you for joining me through this journey, and hopefully this has been helpful for you. Today we are going to get into the fun part, the part that every patient wants when they walk in the door. They come into you, they're telling you about their problem, you start to educate them in activity modification, and when you pause to take a breath, they ask, but aren't there any exercises that I can do? So that is what we are going to be talking about today, is exercises and stretches that might be appropriate for patients with wrist tendonitis. Let's get into it. So, first things first, you cannot stretch away or exercise away tendonitis. It is just not going to happen. It is all about modifying your activities, taking the rock out of your shoe, right? Like we talked about, if you stretch your foot and the rock is still in your shoe, the thing that's causing the aggravation of your tendon, it's not going to feel better, right? The rock is still poking you. So you've got to get that rock out first. But stretches and exercises are supplemental and they will help. They can help to offload the tissues. They can help to lengthen the tissues that are really tight or stiff, and to make sure that you are not losing range of motion or functional mobility. It's also helpful in injury prevention. So the stretches and exercises, I always educate people, they are not meant to be just a temporary thing until you feel better. You really should be stretching if you do any type of repetitive work, any type of static positioning, awkward positioning, postures that might be awkward or uncomfortable, so that you can prevent future injuries as well. So stretches are not the only thing that matters when treating wrist tendonitis, but they are helpful and they can be helpful. It is going to depend on a case-by-case matter, and so you really need to get a good assessment of your patient to make sure that they're going to be appropriate for stretches. It's not a one-size-fits-all type of situation. Like, I can't tell you, here's the exact, stretches that I give every single patient with Decker veins. Here's the exact stretches that I give every single patient with extensor tendonitis. Like, it's going to totally depend on the person, their anatomy, their mechanics of movement, if they are hyper or hypomobile. There's a lot of different factors. It also depends on how irritable their tissues are. Sometimes people are in a really acute flare-up and they are not appropriate for doing stretching because it just makes things worse. So you have to really proceed cautiously and not just give things to people just because you think that that is what you give to everybody that has wrist tendonitis, right? So you just have to be very intentional. So something that I always make sure to educate my patients in is stretching around the clock, especially if they are somebody that has a repetitive or an awkward positioned job, or they're in static positions for a lot of the day. Trying to stretch every couple of hours is really helpful in offloading your tissues and giving your body a little bit of a break so that you can continue to do this repetitive work over time. I also make sure to tell my patients the stretching should not be painful. If you are feeling pain, it doesn't mean you should push through it, right? You need to ease back, or you need to not do that specific stretch, or reach out to your therapist so that you can find another way or a modification that you can do. Stretching should be kind of like touching your toes. It's not comfy, but it doesn't hurt either. If you push to pain, you're just going to make things worse. So that's really important to educate your patients. So I know that I said that there's not one specific exact program of exercises that I always give everybody with wrist tendonitis, but I do pretty much always give postural exercises for these people because I find that most humans in general tend to have really tight pecs and chest and anterior shoulders, so their shoulders kind of roll anteriorly and they get into kind of this like hunchback kind of position. But we tend to, as humans, have weak chest, tight chest muscles and weak back muscles. So our scapular stabilizers are typically weak on most people, and so we kind of end up in that position naturally. So I do tend to give postural stretches if we have proximal stability, if we have kind of this mechanical improvement happening proximally, then distally we're going to have less compensatory movements. If you are strong in your scapula and you're able to lift things or be in a proper position, you are going to have less issues of wow, I always say that word wrong every freaking time. Compensatory patterns. So you're going to have decreased compensation and less stress on your wrist extensors and flexors, on your finger muscles, so that they don't get overworked, right? The bigger muscles and bigger joints should be the prime workers, not the tiny muscles of our forearm and our hands, right? So that is always important. I do like to give typically like shoulder retractions. So I instruct people to imagine there's a pencil right up down your spine and you're trying to squeeze the pencil between your shoulder blades and then relax. Typically people like this one because they can do it anywhere. They can do it at their desk, you know. I do a lot of times give chin tucks as well, or the double chin exercise. So just again, keeping the eyes straight forward and pulling the chin back gives you a little double chin. So again, I'm just going from a relaxed position. I'm not sticking my neck out. Just relax, pull back, right? Sometimes I tell people, imagine that you are wearing like this exquisite piece of jewelry, or you just really want to take up space. You want your beautiful jewelry, your beautiful necklace to be shown to the world. That sometimes helps with posture too. I also tend to give people doorway stretching. So again, finding a door frame, putting both arms up overhead, and then leaning through the door. Make sure they don't hunch. That's also a really great exercise to help open the chest or pecs. If that's too intense for people, they can lay down on a foam roller and just lay in like a snow angel-y position. So that's also a good way to kind of help stretch out their posture. It's simple. They can do it a few times throughout the day, and people tend to remember those pretty well. For some patients, if they are appropriate, I will occasionally give some forearm stretches, or I will often give some forearm stretches. They might not always be appropriate for that. If it causes pain for them to stretch, it's probably not the right exercise. So again, something you can do, you might not have to. Tendon glides can also sometimes be pretty helpful, just having them roll through to help with inflammation, keep things moving through the wrist without putting too much pressure. The other thing I get a lot of questions about are people say that they feel very weak and they want to strengthen their wrists. Typically strength is not the problem. It could be, right? I'm not saying always, but it's usually not the problem. Most often it's just that, again, repetitive overuse, not taking breaks enough, doing too many repetitive things, awkward postures, that kind of stuff that causes it. It's not usually weakness. I don't tend to give a lot of like wrist exercises for strengthening. If they are appropriate, like meaning they're kind of end stage, things are doing much better pain-wise, and we want to kind of reload the tendon, then sure. I think sometimes doing some wrist isometrics can be helpful or appropriate. I think that can be fine. It's not appropriate for everybody, but sometimes that can be a good exercise that you can do for wrist tendonitis. Just again, kind of have to depend on the person, have to assess them appropriately. The other thing people tend to ask about too is if they can exercise, if they can weightlift, if they can do yoga, push-ups, all these different things that people like to do. I tend to recommend not doing weight-bearing positions, so push-ups, planks, downward dog with their wrists in that hyperextended position, just because it tends to not feel very good and it tends to aggravate things. It's just a lot of load on the wrist while it's trying to heal. So I tend to kind of suggest modifications for that, like either push-up handles, maybe you're doing your downward dogs on the wall, or you're, kind of having a straight wrist position, or just not doing that exercise, trying to find something different to do what you're trying to do with it, right? You don't need to do push-ups. You can do other exercises to help you strengthen your core and your chest. So typically with weightlifting, I recommend it's okay to do it if it doesn't hurt you while you're doing it, and if it doesn't make your pain much worse afterwards. I would not recommend doing things where your wrists are bent or out of alignment. They need to be straight. So you have to watch out for things where people are pressing underweight, where they're pulling down and their wrists are kind of tilted. They need to be aware of those things. I also typically recommend keeping the loads closer to you, so maybe doing like front raises, lateral raises might not be the best at the moment, but it's going to depend on the person. So I do think that weightlifting is helpful and exercise is generally helpful, so I like to let people still do that if they can without pain. That's the key. You need to teach them to respect the pain. If you have pain, it's not something to push through. So that's kind of a rundown of generally the exercises that I think about giving when I'm dealing with somebody that has wrist tendonitis. Again, I know that it's, unfortunately there's not like a one size fits all. There's not an equation or a formula that you can follow where everybody's going to need the same thing. But those are some common things that I tend to recommend. If you have other ideas below that you've tried or that you found have been really helpful, please post them in the comments below. I'm always excited to learn new things, and I think that for all hand therapists, we're always trying to learn more to better help our patients. So please comment in the comments below if you have any suggestions. And thank you so much for watching this video and this video series. I hope that it has been helpful. I hope that there's been something that you've learned from it, or that it's got you thinking about something. And if you enjoyed it, please give it a thumbs up, subscribe to the channel, and I will see you in the next one. Thank you guys so much for watching.